This content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns. Imagine you are clearing out a dusty corner of your garage or perhaps opening up a remote cabin that has been shuttered for the winter. It feels like a mundane chore, just a bit of spring cleaning, but you might be unknowingly disturbing a silent, invisible danger. Every year, thousands of people across the globe encounter wild rodents in their living spaces, unaware that the dried droppings or nesting materials hidden in the dark corners of a shed or attic could carry a pathogen capable of causing severe respiratory distress. While it is easy to dismiss a mouse or a rat as a mere nuisance, the reality is that certain species carry viruses that, if inhaled, can lead to a rare but serious condition known as Hantavirus pulmonary syndrome. It is natural to feel a sense of unease when discussing hidden risks in our own homes, yet knowledge is our most effective tool for prevention. Research suggests that the primary way this virus enters the human body is through the inhalation of microscopic particles found in rodent urine, droppings, or saliva that have been kicked up into the air. You do not necessarily need to touch the animal itself to be at risk. Simply sweeping a floor or vacuuming an area where these rodents have been active can be enough to circulate the virus. While the prospect of a hidden threat might sound alarming, it is important to maintain perspective. Most rodent encounters do not result in illness, and public health data indicates that infections are relatively infrequent. However, understanding the specific environments where these risks thrive empowers you to take proactive steps to safeguard your household. By recognizing the signs of rodent activity and knowing how to handle cleanup safely, you can significantly mitigate potential exposure. We are going to walk through the essential facts about how this virus operates, what the early warning signs look like, and the practical, evidence-based hygiene practices that keep your living environment secure. As we move forward, we will take a closer look at the specific types of rodents that carry these concerns and the environmental conditions that make them more likely to seek shelter in human structures. To understand the nature of this pathogen, we first need to look at what hantavirus actually is from a biological standpoint. At its core, hantavirus is a genus of viruses that primarily travel through the air, carried by the microscopic particles found in the urine, droppings, and saliva of specific rodent species. Unlike many other respiratory illnesses that spread through direct human-to-human contact, hantavirus is almost exclusively transmitted from animal to human. It is a zoonotic disease, meaning it lives in the natural world, waiting for an accidental intersection with human living spaces. Most common respiratory viruses, like the seasonal flu or the common cold, primarily affect the upper respiratory tract. Hantavirus, however, targets the blood vessels and the lungs with a specific intensity. It triggers a robust immune response that, while intended to fight the invader, can inadvertently lead to significant fluid buildup in the lungs, making breathing increasingly difficult. Within this viral family, medical experts distinguish between two primary clinical manifestations. The first is Hantavirus pulmonary syndrome, or HPS, which is the form most commonly identified in North America. In contrast, hemorrhagic fever with renal syndrome, or HFRS, is more frequently documented in parts of Europe and Asia. As the name implies, HFRS primarily impacts the kidneys and blood vessels, often resulting in internal bleeding and potential organ failure. It is vital to recognize that these are not merely different names for the same illness, but rather distinct pathways the virus takes depending on the specific strain involved. Research indicates that the severity of these reactions can vary greatly, and because the virus does not easily transmit between people, the primary focus for safety is limiting exposure to rodent-contaminated environments. By treating these as specific biological challenges rather than a singular, monolithic threat, we can better appreciate the importance of environmental control. Understanding which rodents pose the greatest risk and recognizing the telltale signs of their presence in your home is the next step in ensuring your personal safety. Beyond identifying the specific rodents that act as reservoirs, we must confront the mechanics of how this virus makes the leap from a wild animal into human lungs. The primary danger isn't necessarily a bite or a direct encounter. Instead, the risk is hidden within the microscopic particles of the environment itself. As these waste products dry, they become brittle and prone to fragmentation. The critical moment of transmission occurs when these materials are disturbed. Once these particles become aerosolized, meaning they are suspended as fine dust or mist, they can be inhaled deep into the human respiratory system. Research suggests that these viral loads can remain infectious in the environment for several days, depending on factors like temperature and humidity, which makes seemingly abandoned areas surprisingly hazardous. Your risk level is heavily dictated by the environment. In these spaces, humans often stir up accumulated dust that has been contaminated over weeks or months. It is not just the presence of the rodent that matters, it is the disruption of their dried excreta that creates the pathway for infection. Even in modern homes, if rodents gain access to wall voids or attics, the air circulation systems can occasionally distribute these particles. While this is less common, it highlights why sealing entry points is a foundational aspect of public health. We are essentially looking at a biological hazard that behaves like common household dust, which is why standard cleaning practices, like dry sweeping or vacuuming, can actually be counterproductive. Recognizing these high-risk scenarios allows you to shift from a state of general anxiety to one of informed precaution. By understanding the specific conditions that facilitate aerosolization, you can manage your surroundings with far greater precision. To understand exactly how the virus navigates the immune system and triggers the onset of symptoms, we need to look at the internal timeline of the illness. Once that internal timeline begins, the virus moves through the body with a deceptive quietness. During the initial phase, which typically spans from 1 to 5 weeks after exposure, the symptoms often mimic a common seasonal flu. You might start to notice a persistent fever, accompanied by muscle aches, particularly in the larger muscle groups like your thighs, hips, and back. Because these signs are so nonspecific, it is incredibly difficult to distinguish hantavirus from a typical viral infection in these early hours. However, the nature of the illness shifts as it progresses into the second phase, which is where the clinical picture becomes significantly more severe. Research suggests that this is the point where the immune response, while attempting to fight off the pathogen, inadvertently causes damage to the small blood vessels in the lungs. This leads to the hallmark sign of the condition, Hantavirus pulmonary syndrome. As fluid begins to leak into the air sacs, that tightness often evolves into rapid, labored breathing. It is vital to note that this respiratory distress can escalate with alarming speed, sometimes within just a few hours. While pulmonary complications are the primary concern, studies indicate that the virus can occasionally impact other organ systems as well. In specific strains, medical professionals observe signs of kidney involvement, which might manifest as changes in urinary output or persistent swelling. The danger lies in the speed of this decline. What begins as a manageable fever can turn into a life-threatening emergency if the respiratory system becomes compromised. Because the early indicators are so easily mistaken for common ailments, observing how these symptoms evolve is essential for recognizing when the situation has moved beyond a simple infection. Now that we have mapped out how the illness physically manifests, we need to examine what happens when you seek medical help and the specific diagnostic hurdles doctors face when trying to confirm a case. Once your healthcare provider identifies the clinical markers consistent with hantavirus, the focus shifts immediately to stabilization. Instead, medical management is strictly supportive. In a hospital setting, this means prioritizing oxygen therapy, mechanical ventilation, and advanced monitoring to assist the lungs and heart, while your immune system fights the infection. The goal is to shepherd the body through the acute phase of the illness, providing the structural support necessary to prevent respiratory or cardiac failure. If you discover a space that has been neglected or potentially colonized by rodents, do not, under any circumstances, sweep or vacuum the dust. Disturbing these areas causes dried urine, feces, and saliva to aerosolize, creating a cloud of infectious particles that can easily be inhaled. Start by airing out the space for at least 30 minutes, keeping doors and windows wide open to allow fresh air to circulate. When you begin the cleanup, wear high-quality personal protective equipment. Thoroughly soak the area, including any nests or droppings, with a mixture of household bleach and water or a high-grade disinfectant. This process effectively kills the virus and ensures that you are not breathing in contaminated dust. Once the area is clean, Dispose of the waste in a sealed plastic bag and wash your hands vigorously with soap and hot water. Inspect your home for holes as small as a dime, as mice can squeeze through incredibly tight gaps. Seal these entry points with steel wool and caulk or heavy-duty hardware cloth. By removing the incentive for rodents to inhabit your living space, you drastically reduce the risk of exposure to the virus in the first place. Having covered the essential steps for sanitation and the reality of clinical care, we must now look at the broader picture of public health surveillance and what the future holds for hantavirus prevention on a global scale. Moving beyond individual vigilance, the scientific community is actively refining how we track hantavirus across diverse ecosystems. Recent epidemiological studies are shifting from reactive measures to predictive modeling, utilizing satellite imagery and climate data to anticipate rodent population spikes before they enter human settlements. By mapping environmental shifts, researchers can now identify high-risk zones with greater precision, allowing public health officials to issue localized warnings long before an outbreak begins. These technological advancements in viral surveillance mean we are becoming far more adept at understanding the intricate dance between changing landscapes and zoonotic disease transmission. Looking ahead, the goal is to develop more accessible, rapid diagnostic tools that can be deployed in rural or remote areas where access to specialized laboratory equipment might be limited. The faster we can confirm an infection, the more effectively medical teams can provide the necessary supportive care that improves patient outcomes. It is a field defined by constant evolution, where the synthesis of ecology, data science, and clinical medicine creates a stronger barrier against the virus. To summarize the essential health takeaways, keep your home environment sealed and sanitized to discourage rodent nesting, avoid stirring up dust in areas where droppings may be present, and prioritize professional cleanup methods if you encounter significant rodent activity. Early recognition of flu-like symptoms after potential exposure is your most powerful tool. Should you experience high fever, muscle aches, or sudden respiratory difficulty, seek medical evaluation immediately. This content is for informational purposes only. Please consult a doctor for health concerns. If you found this information helpful, consider subscribing to stay informed on the latest developments in health and wellness, and feel free to share this video with those who might benefit from these safety practices. Thank you for watching, and stay well. Moving beyond individual vigilance, the scientific community is actively refining how we track hantavirus across diverse ecosystems. Recent epidemiological studies are shifting from reactive measures to predictive modeling, utilizing satellite imagery and climate data to anticipate rodent population spikes before they enter human settlements.